Hello, my name is Shanika Hampton, and I will be presenting my final project for the ATRN 7130 Patient Reported Outcomes course. The topics are divided into a four-part construct, including the first part, which is the introduction of the clinical scenario and how the scenario fits within the ICF disablement model. Part 2, which is a critique and comparison of the two selected pro instruments and deciding which one is best fit. Part 3 is how to measure change in the health status, and Part 4 is how to implement outcomes assessment into my practice. A 19-year-old female college sophomore tennis player presents with general, nonspecific, chronic low back pain. Upon presentation, pain has been off and on for approximately 4 weeks. Within the last week, there has been a slight increase in pain intensity and duration, with numbness and tingling that occurs near the end of matches. That sensation is ongoing for a period of time, even after the matches have ceased. The athlete comes into the athletic training room seeking treatment as pain is interfering with the tennis playing ability, specifically with the overhand serve, and being able to play for longer than 30 minutes. As the injury is now affecting her coursework, the athlete is unable to sit for a 50-minute lecture class any longer than 30 minutes before pain onset occurs, with subsequent tingling in the legs and feet. She has been reduced to playing only doubles matches as singles matches take place usually during the time frame in which pain has already occurred. She has a previous history of low back pain that is a result of a left-sided grade 1 erector strain that occurred 4 months prior to presentation to the athletic training room. Due to the pressure from her head coach for playing through intolerable pain levels and having a full return, she is seeking treatment as quickly as possible to secure her number 1 spot on the team and for any other assistance that the athletic trainer can lend. The International Classification of Function Model, or the ICF model, established by the World Health Organization, provides a framework of 5 domains for the athletic trainer to see all the aspects of the athlete's health status. It emphasizes whole person perspective of the injury itself, and it looks at all the health aspects that influence the health status. The top row, or the health condition, is the main health domain. The bottom 2 rows are the health-related domains. So as you can see, each part of the disablement model is filled in with the information from the clinical scenario previously discussed. On this slide, we see the health-related quality of life construct presented on this slide. See the health-related quality of life HRQOL construct presented in this slide. We see the basic components and domains of this concept demonstrated with overlapping circles. The physical, social, spiritual, economic, and psychological aspects, which are all influenced by one's personal experiences, beliefs, values, and perceptions of any given aspect of life. In the case of the 19-year-old tennis player that I've been evaluating, the domains highlighted in the blue areas are areas that warrant evaluation. As athletic trainers, and for me in this case, at the Division I college level, we are all trained to evaluate and ask questions about the highlighted domains. The physical in this instance is the driving force for the athlete seeking treatment from us, and this is with regard to the level of physical function. The social and psychological aspects get evaluated by default as we become the parents away from home. We're obligated to keep information confidential, so that provides a sense of comfort for athletes to reveal information in those areas that we as professionals can recognize as factors influencing the progression or digression of health status. On this slide is a display of the 2 outcomes instruments selected for measurement of low back pain. The Oswintry Low Back Pain Disability Questionnaire, or the ODQ, is deemed as the gold standard for evaluating low back pain in patients, and the McKelly Functional Scale is a new measurement tool that was just introduced in 2012. You can breeze through the questions on both scales and make judgment as to which tool is related to the average everyday person with low back pain and which one is geared toward the more athletic population. So under comparison for the 9 listed criteria that you see before you, it is pretty visible that both measures are fairly evenly matched. The MFS shows to be the better choice for functional evaluation and feedback from our 19-year-old tennis athlete, asking questions about bending and jumping, as opposed to the ODQ, asking questions about activities of daily living. Because of the complexity of the chronic injury and daily activities are important to the athlete's recovery, both tools would actually show to be a great use at different points in time of the treatment. But in this case, for our 19-year-old, again, the MFS is the best choice for athletic function. When we look at interpreting ways to measure patient health status, in this course, we were introduced to the terms of the MDC, MIC, MCID, and more recently, the ROC, also known as the Receiver Operating Characteristic Curve. As a means for interpreting the reliability of a measure, the MDC represents the notion that change has occurred. This value is not relevant to athletes and is not reflective of the change that they would be perceived as occurring. This change is only seen as being statistically relevant. The MIC, which also equals the MCID, is referred to as the minimal clinically important difference. The MIC, when determined, would be a value that represents true change has occurred and helps the athletic trainer decide how to proceed with care. This change could represent either improvement or worsening of a given health status. Because the MFS is such a relatively new tool, not much research exists using it in an athletic training practice. At this point, only positive application to observe change in the athlete's status was referred with positive correlation to the outcomes of the ODQ, and that the questions were geared solely toward the athletic function and general health status. With no apparent research to suggest the parameters that indicate MDC or MIC classification, inferring the clinical measurement of the health status change in athletes is low and is difficult. Davidson et al. 2002 stated that the MDC for the ODQ is either 10.5 or 15 points, and therefore a therapist would need to see a change of at least 10.5 points and possibly as much as 15 points, in our opinion, to be 90% confident that real change has occurred. So this lends the window of opportunity for more research to be done for the MFS to see if it really is a great tool for athletes. And it also leaves the window of opportunity open for one to develop their own test. So we'll conclude the presentation by briefly looking into ways to implement the patient-reported outcomes instrument into the college athletic training setting practice. Please make important notation that we are dealing with athletes from the age range of 17 to 22, and we're also dealing with a university that has very low funds and very low athletic training staff. With this, it is the responsibility of the athletic trainer to clarify and define clear expectations when directing student athletes on how to access these tools, along with the importance and rationale for using them. One simple task is to remind the student athlete that this tool is not something that will be completed upon every visit that they come into the training room. This gives them the insight as to how they feel and how to better service them with planned care that they have a say-so in. So having explanations and reasoning for the necessity of the measurement usage provides a simple solution to the barrier of possible dishonesty reporting from the athlete due to sheer ignorance of the meaning of the tool. Now, any form of technology with Wi-Fi, i.e. phones, tablets, computers, etc., yields the ability to go to a website and pull up the given tool needed for any particular time. Just as any exercise or any other outside work can be given to a student athlete to complete, a PRO instrument can also be assigned. Hopefully you've enjoyed this brief, or maybe not so brief, presentation on this final project. Please see the supplemented Word document at all of the research as it's presented in full. Thank you and have a great day.